This is Med School Radio, and we're looking at some more summaries from the review sections of QBanks. Let's get right to it and see if we can learn something from the reviews of questions. Okay, remember, Purkinje cells send inhibitory GABA projections to the deep cerebellar nuclei, which are the sole output of the cerebellum. Alcoholic hallucinosis refers to the onset of visual, auditory, and tactile hallucinations 12 to 24 hours after consumption of the latest or the last alcoholic beverage. It is differentiated from delirium tremens by the timing of its occurrence and the severity of its symptoms. So remember that alcoholic hallucinosis refers to the onset of visual, auditory, and tactile hallucinations 12 to 24 hours after the last drink. The cerebellum, or neocerebellum, includes the lateral hemispheres of the cerebellum, which function in motor planning and complex coordination. Lesions of the cerebrocerebellum typically present with dysdiadochokinesia, or inability to perform rapid alternating movements, and intention tremor, which is a broad, coarse tremor that worsens as visually guided movements reach their endpoint. Under aerobic conditions, NADH transfers electrons to pyruvate to form lactate and regenerate NAD+. NAD+ is required to convert glycerolaldehyde 3-phosphate to 1,3-bisphoglycerate to glycolysis. Okay, and moving on. On posterior anterior chest X-ray, the right middle lobe is seen adjacent to the right border of the heart, which is primarily formed by the right atrium. Consolidation in the right middle lobe can obscure the X-ray silhouette of the right heart border. Niacin is used in the treatment of hyperlipidemia. It increases HDL levels and decreases LDL levels and triglycerides. Niacin causes cutaneous flushing, which is mediated by prostaglandins and can be diminished by And continuing on, so we just talked about niacin. Now let's talk about Streptococcus pneumoniae. And remember that Streptococcus pneumoniae are gram-positive, alpha-hemolytic, optochin-sensitive, bile-soluble diplococci. Viridans group Streptococci are also alpha-hemolytic, but they are optochin-resistant and bile-insoluble. Streptococcus pyogenes, or group A Streptococcus, appear as gram-positive cocci in chains with bacitracin susceptibility. Acute rheumatic fever is a complication of untreated group A streptococcal pharyngitis. Rheumatic heart disease is the most common cause of acquired valvular heart disease and cardiovascular death in developing countries. The incidence of acute rheumatic fever and rheumatic heart disease has been reduced in industrialized nations with prompt treatment of streptococcal pharyngitis with penicillin. Okay, so let's move on. Digoxin toxicity typically presents with cardiac arrhythmias and nonspecific gastrointestinal, for example, nausea and vomiting, neurological, for example, confusion and weakness, and visual symptoms. Elevated potassium is another sign of digoxin toxicity and is caused by inhibition of the sodium-potassium ATPase pumps. Both perfusion and ventilation are highest in the base of the lung and lowest in the apex. However, the variability in perfusion is greater than that in ventilation. This causes the ventilation-perfusion ratio to follow the opposite gradient. It is lowest in the base and highest in the apex. The best and most reliable auscultatory indicator of the degree of mitral stenosis is the A2-OS interval. A shorter interval indicates more severe stenosis. Other auscultatory findings can include a diastolic rumbling murmur with presystolic accentuation due to left atrial contraction. Atrial flutter demonstrates rapid and regular atrial activity in a sawtooth pattern, or flutter, or F waves on ECG. Typical atrial flutter is caused by a large re-entrance circuit that transverses the cavotricuspid isthmus of the right atrium, which is the target site for radio frequency ablation. And moving on, ventricular fibrillation is the most frequent mechanism of sudden cardiac death in the first 48 hours after acute myocardial infarction and is related to electrical instability in the ischemic myocardium. Brassy, barking cough, dyspnea, and recent history of upper respiratory infection in a child are suggestive of viral laryngotracheitis or croup. The most common cause of croup is parainfluenza virus. In the fibrinolytic pathway, tissue plasminogen activator or TPA converts plasminogen to plasmin, which then breaks down a fibrin clot. The administration of a TPA analog, for example, alteplase, tenecteplase, or streptokinase, triggers fibrinolysis and can restore myocardial perfusion in patients with ST elevation myocardial infarction who cannot undergo timely percutaneous coronary intervention. Intermittent explosive disorder is characterized by recurrent episodes of explosive verbal and physical aggression. The aggressive behaviors are impulsive and grossly out of proportion to the provocation. Subclavian steal syndrome occurs due to severe stenosis of the proximal subclavian artery, which leads to reversal in blood flow from the contralateral vertebral artery to the ipsilateral vertebral artery. Patients may have symptoms related to arm ischemia in the affected extremity, for example, exercise-induced fatigue, pain, or paresthesias, or vertebrobasilar insufficiency, for example, dizziness or vertigo. So that was subclavian steal syndrome. Athlete's heart refers to physiologic cardiac adaptations that improve cardiac function in response to high-level endurance training. There is predominant eccentric hypertrophy with a smaller component of concentric hypertrophy, leading to an overall increase in left ventricular mass, enlarged left ventricular cavity size, and increased left ventricular wall thickness, and decreased resting heart rate. Tumor lysis syndrome can develop during chemotherapy for cancers with rapid cell turnover, for example, poorly differentiated lymphomas and leukemias. Substantial tumor burden or high sensitivity to chemotherapy. It is characterized by hyperphosphatemia, hypocalcemia, hyperkalemia, and hyperuricemia. Prevention often involves hydration and the use of hypouricemic agents such as allopurinol or rasburicase. Hypoacetylated histones bind tightly to DNA and prevent transcription of genes in their associated regions. Alteration of gene expression in Huntington disease occurs in part due to deacetylation of histones. This prevents the transcription of certain genes that code for neurotrophic factors contributing to neuronal cell death. Aortic stenosis is the most common complication of bicuspid aortic valves. Patients with bicuspid aortic valves develop clinically significant aortic stenosis on average at around 50. In comparison, senile calcific stenosis of normal aortic valves generally becomes symptomatic from age greater than 65. Polyhydramnios, which is excessive accumulation of amniotic fluid, presents with increased abdominal circumference out of proportion to gestational age. The etiology is decreased fetal swallowing or increased fetal urination. Fetal anomalies associated with impaired swallowing include gastrointestinal obstruction, for example, duodenal, esophageal, or intestinal atresia, and anencephaly.